Alzheimer's is a complex disease, and scientists are still working to pin down one single cause. However, as of 2026, the consensus is that it is triggered by a combination of biological hallmarks, genetically predispositions, and modifiable lifestyle factors. Think of it like a perfect storm in the brain that often starts 10 to 20 years before the first memory slip occurs. The biological hallmarks. The physical damage in the brain is primarily driven by the buildup of two specific proteins. Amyloid plaques. These are clumps of a protein fragment called beta amyloid that build up in the spaces between neurons. They act like trash that blocks cell to cell communication. Tau tangles. Inside the neurons, a protein called tau normally helps keep internal tracks straight. In Alzheimer's, tau collapses into twisted strands, tangles, which prevents nutrients from moving through the cell, eventually killing it. Neuroinflammation. Recent research of 2025 and 2026 suggests the brain's immune system stays turned on for too long. Instead of cleaning up the plaques, it begins to attack healthy brain tissue. Genetic factors. While most cases are not directly inherited, genetics play a major role in your risk level. Late onset being the most common, the most well-known gene is called the APOE4. Having one or two copies of this gene increases your risk, but does not guarantee you will get the disease. Early onset, more rare. Less than 1% of cases are caused by specific mutations in 3 genes. If you have one of these, you will almost certainly develop the disease, often as early as your 40s or 50s. Modifiable risk factors. The Lancet Commission recently updated the list of factors that contribute to roughly 45% of dementia cases globally. These are things we can actually influence. Vascular health. High blood pressure, hypertension, high LDL cholesterol, and diabetes damage the small blood vessels in the brain, starving neurons of oxygen. Sensory loss. Untreated hearing loss and vision loss are major drivers, likely because they lead to less cognitive stimulation. Lifestyle. Physical inactivity, smoking, excessive alcohol, and obesity. Environment. Recent studies have linked chronic exposure to air pollution and even past exposure to lead to higher Alzheimer's risk. New Frontiers in Research 2025 to 2026. Viral links. Scientists are investigating links between common viruses like herpes simplex and the triggering of amyloid plaques. The gut-brain axis. There is growing evidence the health of your gut microbiome, the bacteria in your digestive system, can influence brain inflammation. Cerebral amyloid angioplasty. New studies show that protein buildup in the brain's blood vessels, not just the brain tissue itself, can quadruple dementia risk. While you cannot completely eliminate the risk of Alzheimer's, especially due to genetics, the latest research from 2025 and 2026 highlight that nearly 45% of dementia cases could be delayed or prevented by managing specific modifiable risk factors. The strategy is now moving towards a life course approach, meaning what you do in your 30s and 40s is just as important as what you do in your 70s. New and crucial sensory and metabolic health. Recent updates from the Lancet Commission 2024 to 2026 have added 2 critical new focus areas. Treat vision loss. Uncorrected vision impairment is now officially recognized as a major risk factor. If you need glasses or cataract surgery, get it. Keeping the brain visually stimulated is vital. Manage LDL bad cholesterol. High LDL cholesterol in midlife is now linked to the buildup of amyloid plaques. Keeping your numbers in check starting in your 40s is a top priority for brain health. Wearing hearing aids. Hearing loss is the largest modifiable risk factor. Using hearing aids doesn't just help you hear, it reduces the cognitive load on your brain, which otherwise has to work too hard just to process sound. The brain healthy diet. Research continues to support the MIND diet, a hybrid of the Mediterranean and DASH diets. The must-haves leafy greens, spinach, kale, berries, especially blueberries, nuts, olive oil, and fatty fish. The limit list: red meat, butter, cheese, and pastries. Surprising 2026 finding: some new studies suggest that while diet is key, consistency over a decade matters more than a sudden crash diet in old age. Physical and mental activity. Midlife exercise. Resistance training and aerobic exercise, like brisk walking in your 40s and 50s, are more effective at preventing dementia than starting at 80. Aim for 150 minutes a week. Cognitive reserve. Higher education early life helps, but lifelong learning in mid to late life, like learning a new language or musical instrument, builds extra connections in the brain that act as a buffer against damage. Lifestyle and environment. Social connection. Chronic loneliness and social isolation are as damaging to the brain as smoking. Regular social engagement keeps the synapses firing. Sleep hygiene. Chronic insomnia prevents the brain's glymphatic system from washing away beta amyloid trash at night. Aim for 7 to 9 hours of quality sleep. Air pollution. Avoid high traffic areas for exercise when possible. Fine particle matter has been strongly linked to increased Alzheimer's pathology in 2025 and 2026 research. The bottom line is, with good lifestyle changes and maintenance and awareness and learning, Alzheimer's dementia can be prevented, and certainly your chances of getting Alzheimer's dementia can be reduced with consistent changes.